low sodium. We have to encourage the patient to take the low sodium diet and low cholesterol diet, and encourage the potassium rich food, because patient is taking the diuretics. Already I told you the potassium loss will be there, so we have to encourage the patient for the potassium rich food, and encourage the patient for the fluid restriction. When we are encouraging the patient for restriction, automatically patient will get the thrust. So as a nursing measure, we can give some suggestion to a candy, hot candy to patient not to get the immediate thrust. So like that suggestion we can able to give. And we have to educate the patient the signs and symptoms of the fluid retention. The condition is becoming worse. Immediately he can come to the doctor and explain that is better. No? That's why we have to report the signs of fluid retention, such as edema, weight gain, those things you can explain to the patient is better. So this education will help the patient not to getting the repeated attacks of this heart failure, and also control the previous medical problems. So this is about the nursing management and heart failure. So I am going to conclusion. That is, heart failure is caused by any condition which reduces the efficiency of myocardium or heart muscles through the damage or loading. For example, that is myocardial infarction. In case of myocardial infarction, it will happen. Heart muscle is starved of oxygen, so it will die. Heart muscles will die. So the functioning, relaxation, contractions, all the functioning will be damaged. So it will lead to the heart failure. And hypertension. In case of hypertension, what happens, that is increase the force of contractions to pump blood. So hypertrophy will happen in this type of condition. That is also one of the causes of heart failure. And one of the third one is amyloidosis. That means protein deposition in heart muscles. It will cause the stiffness of the heart muscles. So it will disturb the contraction and relaxation of the heart muscles. So those conditions will cause for the heart failure. So at last, treatment commonly consists of lifestyle measures such as smoking cessation, decrease in salt intake, and other dietary changes. Of course, the medication is also very important to control and to decrease the heart failure cases. So how to, this is the smoking, that Samantha will discuss you, and this is about the heart failure. I discuss you if you have any doubts. Thank you, sir.
Okay, any questions I can teach you.
আসে সবাইকে সিগনেচার করো হ্যাঁ করেছি তুমি করেছো আমি করিনি এই আমার দুজন বাকি আছে কে বাকি আছে আমরা খাতা দেখি
Regarding heart failure, Sister Sujata has already told you the basic heart failure is not a disease. It is a syndrome complex. It is the manifestation of so many underlying diseases. For example, suppose ischemic heart disease, hypertension, underlying, suppose chronic kidney disease, or underlying myocardial disease, valvular heart disease, anything. There are more than 100 causes of heart failure. So heart failure is not a disease, it is a manifestation. It is a manifestation, and either left-sided heart failure, right-sided heart failure, forward failure, backward failure, high output failure, low output failure. These are the nomenclature. So always heart failure, we have to, if it is the most common cause for hospitalization, and heart failure is a huge economical burden. So if we diagnose the heart failure early, the prognosis will be good, as well as the cost burden on the hospital, on the doctors, on the staff, society, this burden will be reduced. So in particularly Western countries, USA and other places. There are so many places where there is a heart failure clinic, especially is going on. Patients coming with heart failure, they have been properly cared. What the cause? Heart failure, I told you, it is not a disease, it is a manifestation. So look for the heart failure and thoroughly examine the patients and think what is the underlying cause. For example, one patient of a dilated cardiomyopathy and 5 times hospitalization in 1 year in Garden Central Hospital. So the cause is at the DCM. So that is the heart pumping capacity is already declined. Similarly, the so many other patients like your COPD, many terminally chronic obstructive lung disease is going right-sided heart failure, leading to what we are telling cor pulmonale, means COPD leading to right heart failure. So, like underlying ischemic heart disease will lead to the heart failure, LV failure. We are seeing sometimes lung failure, heart failure, both. So we have to thoroughly in hospital, we have to thoroughly pinpoint what is the cause of heart failure. And traditional treatment for heart failure was 3D. One is the diuretics, second is the digitalis, and dilator. Dilator means AC inhibitors. These are the 3 traditional treatment of heart failure. But beside this, lot of what is the underlying cause, accordingly we have to treat it. We have to investigate it, basic medical treatment, surgical treatment, then the nursing care. Sister Sujata has gone through the thoroughly of what are the care. Input output chart is very important because heart failure will lead to the venous testis and lead to the edema. So there are many criteria. We don't want to go for detail, but these are the common manifestations. In hospital, in early hospitalization, we have to thoroughly examine it, and early diagnosis will always give a good result. That is the message. So proper monitoring is very, very important, and there is a very good topic of this, and I hope you all have benefited from this. Our next lecture today, end of this. This year we have succeeded in all the 12 month, 12 year. Now Dr. Samant Rai will give rise to one lecture regarding the 20 minutes only short time. I request you sir to come and give. And at the same time this year 2013, all the sister among yourself, you create your own self, what the topic you need it, so that we can discuss accordingly and volunteer yourself that I will come. Minimum 1 to 2 sisters for 20-25 minutes, and one guest lecturer from our side will gradually do it. Okay. So I hope in the 12-13 this academic feast will be more and more informative. Okay. Thank you.